I'd like to introduce our next speaker. Pat Lang was once a volunteer for PACER and now the Health Information Center Coordinator for PACER. Pat coordinates the F2F Health Information Center, handling calls, emails, workshops, web-based training, publications, web content, and presentations to medical professionals to cooperate in legislative decision makers, families, and teachers. Are you sure we didn't leave anybody out? You got it all? Okay. She coordinates a lot of activities for a lot of people. She's a contributing member to the Minnesota Department of Health Task Force, Midwest Genetic Network, NORD, and a volunteer for Hope Kids in Minnesota. Pat also has the unique perspective of being the mother of a child of medical complexities. So to talk to us about the resources available to healthcare professionals and families, please welcome Pat Lang.
So this is us, and my daughter, when she saw it this morning, said, "That's like the TV show." So if you didn't catch that, that's what it was meant to be, so I was glad she picked up on that. So my daughter in the wheelchair is Madigan. She has a very rare genetic disease, metachromatic leukodystrophy. We actually moved to Minnesota, I love you, from Ohio, for the medical care. And there's some of you in this room that know that you're dedicated and you've helped us. Bonnie, I'm not saying your name out loud. Should I put that on? Hold it, Tom. Do it, because you know I can't do it. Yeah. If I have them all, I don't have them. Just clip it. So we can do it. I'll hold it. Can you hold it?
There you go. Now you're wired for something.
Now am I good?
Now
okay.
Good.
Okay, can you hear me now? Whoops. It's all new technology. I'm an old woman. Okay. So, Madigan's had 2 bone marrow transplants, but we live life large. We're pretty wild, and there's a couple nursing students here that have been to my house that can attest to that. My son is Wyatt. His wife is Cece, and my grandson is Drake. My other daughter is Michaela, and she's has some developmental delays and is on the spectrum. But the reason this picture is important, beside I wanted to share my beautiful family, is that disability affects the whole family, the whole entire family. And because, as Bruce said, it gives us a different perspective as a parent when we go out to work in areas or when we go to doctor's offices. We see it, we know it, we live it. We have experiential knowledge. Now I got to figure out how many of these things I have to hold on to. All right, I'm a mover. This might not work. What if I stay here? Maybe I'll stay here close.
No, it says we're going to ask him to move
there we
it
go.
forward. Just say next slide and he'll move it forward.
Okay. So the other reason that it's important is that I do now work for PACER after 45 years with GE. And I work for PACER, and almost everybody at PACER is a family member or has a child or an adult child now with a disability. So we have a unique perspective, and it's a beautiful thing when we get a phone call and I say, "Oh yeah, I know what Fabry disease is." She goes, "What?" I go, "Yeah, I lived with the family in the Ronald McDonald House." So it's a beautiful thing, and I've learned from a lot of the other parents, and I want to share with you now what PACER does and how amazing they are and how amazing the staff is and how you can use them when you, in your clinics and your hospitals to help families. So we're going to talk about the progress of PACER, the people, and the projects. Everything's a project because now I'm in nonprofit. That's a new thing. So yeah, go ahead. So the mission statement, we're going to enhance the quality of life and expand opportunities for children and young adults with all disabilities and complex medical needs and their families, so each person, each child, each adult can reach their full potential. It started in 1997, or 1977, with an idea and 2 women that wanted to help families and children with disabilities understand their rights in the educational system. I don't want to be sexist, but 2 women, notice that. And they were, I've met them, and they are strong-willed, and we're going to get this done. Okay, I'm going to put these numbers out here because you don't have to remember them, but I want you to be, this is shock and awe, my daughter says, okay? So that number represents the number of phone calls from October 1st to September 31st, 2016 and 2017, so 1 year. It's the number of phone calls that we receive for individual assistance, support, or information. 45,000 calls from families. They're saying, wait, this is too complicated, this is too hard. Who knows anything? 39,000 workshops, presentations, and other events our staff has put together and put on in this same time period. Go ahead. 134,000 newsletters, and we go all across the country because we've done some things in India and Tanzania. We've done a lot of different things, so those newsletters go all across the country. 8,672, the Simon Technology Center, which is an assistive technology center to help families and kids that need help with communication, or we have all different kinds of tools. We just added a thing where we can adapt, you know, those motorized cars, the Barbie car and stuff. We can now adapt those so kids that can't move can use their chin or a switch, and they can be just like the kid down the street and drive these cars. Those contacts and presentations all by our technology center, and it's growing. Next. 2.2 million people across the country have hit our websites. Next. 68,000 people follow us on Twitter, Instagram, Facebook, and probably other things that I'm too old to know. And they're now 75. I did this last week, but we now have 75 people that are full or part-time at PACER. We need more. Go ahead. So we're parents helping parents. I think that is the most important thing. Multicultural staff so that we can go out into the communities and talk. We have translators, and all of the literature and things that we put together, we try to translate into other languages because we know our population is everywhere. We have about 75, somebody said they think it's even higher, collective years working together as champions for children. Approximately, I say approximately, 100% of the people that work have families with kids, are families with kids with disabilities of all ages. Some of the younger families that have joined in the support staff do not, but it's very interesting to watch them as they learn from some of us old people. We also sit on a lot of boards, national and local. We participate with the task force teams collaborating in education and in health. Our educational background, I was blown away by this. The educational background in that building, we have teachers, we have medical people, we have lawyers. We're not supposed to say that out loud, but we do. Not to help you with law things, but because they have kids with disabilities. And so they now are helping you navigate through the systems. We have an OT specialist, we have marketing people, journalism, business leadership, and psychology majors. All people that are living the life and want to help others learn from what they've learned and experienced. We also have, I think this is so interesting, one of the folks that works in our office is 83. I don't know where you guys are going to be at 83, but I think I might be in the sun somewhere. We have another one that's 97, and she is still working and producing, and it's because she has a passion and wants to be a champion for kids. The services that we provide children and parents, we teach about their rights. We really want, I think Mark said it, we want to teach them to be advocates, right? Self-advocacy. That's what we are trying to do. We can't, with all the calls we get, we can't go out, we can teach you. We can't go out with everybody that needs us. We can help you, we can guide you. We go out in some extreme cases. We teach them all about policy. We teach them about procedure. Pertaining to both educational things, IEPs, IHPs, if you know, individual health programs, 504s. We do financial health outcomes for their kids. We help with these crazy waivers and financial stuff that's out there that nobody can understand, right? So we're trying to make all of that simple. We get tons of calls about that. Go ahead. We have drop-ins. People are pretty frantic. And so we have drop-ins where people said they couldn't wait, they want to talk to somebody, they need to see us. We get the phone calls. I do home visits a lot with my multicultural guys. I'll go out with them and they can be my translator, and we go to homes in the community to help. Again, with the IEPs, 504s, the educational team, so we're split up a little bit. So we have educational advocates. They're much smarter than I am on the education system. I've only been at PACER for a year now. But I help with the 504, which are accommodations, and I help parents write IHP, which is an individual health plan if they might have a baclofen pump, or they're diabetic, or things like that. We have free workshops all over the state, and we live stream now, so we're in the big time. So we're learning to live stream, we're practicing that. It's funny to see people my age learning to do all these things. We have a big health symposium. We had 1,200 people attend last year. It was huge. It's a one-day event, and there were 1,200 people that attended. Medical and healthcare resources, we have to be very careful, but we publish stuff on the web when we know that perhaps there's a dentist that takes MA. There are a lot of dentists that don't take medical assistance, so we will post things like that. I'm actually helping a family now for my son. He's in Seattle, and he called and he goes, "Mom, my friends need help. They have a baby with Pfeiffer syndrome. Can you help them?" And so I said, certainly, I'll help. So I've been getting people involved and helping them from here and helping them navigate in their state with their counties and with federal services to show them what they're eligible for and how to talk to the doctors and get the care they need. Go ahead. So we work under projects. We're funded by a lot of grants, and so we have all these different projects. I'm just going to walk through them quickly just to give you an idea of all the activity that goes on there. So the first one, the Health Information Center. That's the one that I'm in charge of. So we are trying to navigate the healthcare system, as I said. Not only do we try to decipher all the rules and all the waivers and all the changes in the waivers, Medicaid, Medicare, MinChoice. We teach a class in care coordination, so we teach parents how to coordinate all their care and get it all done so that they can work if they work, and how to get it done and what to say and how to say it so they can get the action that they need. We teach guardianship. We have a program, and it's why I started at PACER. It's called PART, Parents and Residents Together. And I have to say, it wasn't mine. It is brilliant. I think they've been doing it for 20 years. What it is we match families with residents from the University of Minnesota. And it's so that they can get a real life experience by visiting our homes and see what it's like in the home after they tell you all the things you're supposed to do in the office in the 17 minutes that you get, or 7 minutes. So they come visit. This program's been ongoing for, like I said, I think 20 years now, and it's expanded. So we have pediatric and we have an adolescent rotation. And one of the residents that came to my house said, "We got to do one for medically complex." So they just started a brand new rotation, and they have 4 young residents that are going through that program. I was trying to come up with another idea to match more people, and I came up with an idea, and it was so funny. I thought it was brilliant, and I was at the U of M, and one of the doctors called me in. He said, "Come here, I got a couple med students that want to talk to you." Here, their idea was better than mine. They wanted to match up med students with families, just like the resident program. Because all the statistics are saying nowadays that med students lose empathy, or don't have a handle on empathy because they're so busy learning the medical and the scientific, and that they need to learn that. They need to learn how to communicate with the families. And so I've been doing a presentation at the U on empathy, and they told these kids that, and they said, "We want to do a program." So we do. We have 14 families. It's called Gopher Buddies. And it's amazing. They're matched with we matched them with families. So my Gopher Buddy is amazing. And she'll call me up and say, "Are you going to church Sunday?" I'll go, "Yep." She goes, I'll come help you load the car. Because she knows now, she's been at our house enough, she knows all the equipment that I buy from PHS that I have to put in my car. And so she comes and she helps me load. She goes to church with us. After exams one night, she goes, can I come over? I want to come over, I'll bring dinner. And she brings dinner. And so for 1 year, she's matched with our family. We have 13 other families that are matched the same. And so as they go through this lessons that they're learning in school, now they're seeing both sides and not just getting the one side. She loves it, I love it. We work with telehealth. I'm working on it's called Midwest Genetics. So we're working as a team to learn how we can help genetic diseases by helping the other areas in Minnesota that we don't get to reach, or that they might not have doctors there that are aware of genetic illnesses. So I'm working with seven states. It's a collaborative, and we're working on coming up with training modules for doctors to teach them. We're working on the telehealth sites so that we can get those set up. And we're working on how to train families, how to ask the questions that they need to ask or recognize symptoms. Go ahead. Medical transition, we'll talk about that later. We do a lot of, Saturday we'll finish a medical leadership training class. It's an 8-week class, it's brilliant. And it makes moms who are so overwhelmed realize how awesome they are. So it's a leadership class. It helps them see their skills and then use their skills to advocate for their kids. It's an amazing, I get to see it when they first start and they're shaking and they're crying and they're scared, and we get them for 8 weeks. And they, in order to graduate from this class, they have to come up with a project. And I already know one of the projects, and it's going to be sold on the market very soon, what she came up with. So I can't tell you, but it's amazing. And she said, I knew how to do this, I wanted to do this, but my son is so complex, but I knew I couldn't pass this class if I didn't come up with a great project. So yay, okay? You'll see it when I can tell you, I'll make sure you know. But it's moms together that get away, that get to be real. We had one class last year where I had one man. There were eight women and one dad. And I watched him, because I do that, and I'm watching him just because I knew that he was uneasy, so I was trying to get over there by him and try to make sure he felt comfortable. When it was his turn to talk, he started to get all choked up, and what was cool, I'm going to probably cry here, they did the same. The other moms came up behind him, and we were all cuddling him, and he said, this is the first time in my life, and she's 7, that I've been able to talk out loud about it. Because he felt like he has to be the strong guy at home, and he couldn't talk about it. He felt like he could, and he probably could have, right? But it was a beautiful thing to see him come alive in that day and talk and be able to speak and talk about it and talk about his feelings, and we were all loving him and hugging him to death. So it's an unbelievable experience when you really understand and can see what people need, and you can fill that void for them. Again, 504s, drop-ins. The other thing we're teaching, I'm working really hard on it, because I wasn't very good at it in the beginning when this started for me in 2001. Effective communication. If we want our doctors to talk to us nicely and to understand us, we have to effectively communicate with them as well. And so, one, if we only have 7 or 17 minutes to talk, we got to make sure we have our words in some organized fashion. I always say you don't show up to throw up, but you just have to make sure that you communicate effectively so you get the most time you need, your answers answered, and so we teach an effective communication skills. And I'll tell you that when I first started, I came to live in the Ronald McDonald House from Ohio, and my doctor was just brilliant. He's from the University of Minnesota. I love him to this day, but he had no social skills, okay? None. He was brilliant, so that's why I wanted him, because he's brilliant. And he was going to, at least tell me the truth and take care of my kiddo. But communicate with them? Holy snikes, I just couldn't. And so finally, I found out I was part of the problem. Me? Yeah. Because he would come in and he'd be all rushed and stuff. And so finally, one day I said, I feel like this when I said, you made me feel like this when you come in here like that. That was wrong. That was way wrong. So one day one of the nurses came in, God love nurses, and said, if you said, I feel, instead of you made me feel, that might be better. Well, I got to tell you, I started that. Now my nickname is I Feel. But he and I are best friends. He moved on. He's in Onalaska, Wisconsin, and we talk every month. He's not our doctor anymore, but he's our best friend. And he's amazing. He's amazing. But we have to teach both sides. How do you communicate? How do you ask those questions as a physician to get to the answer that you need? As parents, how do you talk about the things that are most important to help get a good decision? Partnerships. I'm in a lot of partnerships. Sometimes I can't even remember all of them. I mentioned most of them. MDH, DHS, Family Voices, Hope Kids, MCH, and we do presentations for everybody. I beg people to let us talk so you know who we are and what we do, so that we can show you we got things and we can help you so your job's not as hard. We have a mental health team. They're amazing. I learn a ton from them. There are two ladies. Both of them have adults, children with mental health issues. We have a mental health teen board. So these are kids that live the mental health ups and downs, and they're a board, and they're amazing to see what they're doing and how they're listening to their partners and their friends at school now differently. And they teach, the health team teaches parents and adolescents how to advocate for themselves or for their child. They guide them through all the supports and resources that are out there that we have or that are in the state. And they try to figure out strategies that they can use to help their kiddo down the path. They know about the crisis line. I mean, they try to teach everything that parents need to be an advocate and students. And the teen board is right there to come up with ideas for kids so that they can help their counterparts. Simon Technology Center, I mentioned it. This is just kind of a look at what it's like. It is amazing. The little white thing that you see right here is a robot. So now when you're in the hospital, you don't have to miss school. So we can communicate back and forth. And there are things that we can rent out. And it's normally not a price tag to do that. So we have a lending library that's open, and there's all these switches and books and different kinds of assistive technology that someone can go in on a Saturday and rent it to see if it's something they want to buy through their waiver. I mentioned the Barbie Jeeps. They're amazing. They just set up a new site where you can resell equipment. And it's been a huge, huge success. So they set it up, so now if you have a wheelchair that you've outgrown, you can sell it to somebody else, or anything. They have a live scribe pen. I think I needed that when I was in college. You can take notes and then hit a button and it'll read back the notes that the teacher gave and tell you, like if the teacher says, this is gonna be on the test, you can mark it with a star. It's amazing, and it's cheap. And yeah, I know. And it's a live scribe pen. We have the robots, switch-driven devices. So we have a device that Maddie can't move now, her arms or legs, but intellectually she's all totally there, and we have more fun with that whole thing. But she now we bought her, the nurses actually, bought her a boombox, because that's the only name I know for what you call them now. And so you can I can load the CD. She'll tell me which song she wants, and she loves King and Country for you guys from Northwestern. She loves King and Country. We'll put it in. She has a little thing here. She just goes, and it plays. And she has a hat that's got lights and songs, and she goes and plays it. So she is doing amazing things. She's also doing that with the computer, and she's able to answer questions in school because she can look at it, she can hear, and then she can use the switch. It's amazing. It's amazing. They teach a code class to kids. They have an Excite camp for girls. They have STEM classes for girls. It's amazing. They gave girls, I think they did it for both girls and guys, the equipment to build a robot, a little one, and they had to program it and stuff. Yeah. It's amazing to see these kids. And sometimes the kids at home that have siblings that aren't disabled, one day they said that the the sibling that wasn't disabled came in the wheelchair because he wanted to do it. He said, can I be the helper? So they do exciting things. Bullying. We are now the National Center for Bullying. So we have an office in Minnesota and California. On their website, on the bullying website, 1.4 million hits. We do so many things. We talk to schools, we talk to parents, we talk to policemen. We do bullying activities. There are kids on the bullying team as well that come in and tell us to keep us focused on what's happening now, because we know it changes. And so we're teaching them to be advocates. One of the kids in our class came up with an idea how to involve kids at lunch. And so now whenever they see anybody with alone, they go up and get them and sit with them. So there's a ton of different things. Kids with disabilities are bullied, and I forget the statistics, but it's much higher than kids that don't have disabilities. So we're trying to help with that as well. Oh, there it is, 2 to 3 times more likely to be bullied if you have a disability. October is always bullying month, and orange is the color against bullying. So in October, wear your orange. It's a big deal. You can be that one person that makes a difference when it comes to bullying, and we have seen huge change. We are amazed at some of the students that come in and talk about how they were bullied and then how that's changed. So it's important. Go ahead. Puppets. I have to say I did know about the puppets. They're life-size, they're multicultural, they're handmade, even the hair and everything. And they've been there for, I forget, even longer than 20 years. And they teach tolerance and inclusion. So when I first saw them, I'm like, really? We got the internet now. And you know I'm a technophobe. I still thought that maybe puppets were out of date. Are you kidding me? No. They go everywhere, and they wear real clothes for their size, so that helps. They are sold all over the world now, and they send a script. We have puppeteers that go and talk, but they are sold as a kit with the script and the puppets. They say, we want a blind child, we want black, yellow, white, red, whatever. And we send it and sell the kits to schools and facilities all over. Go ahead. The Federal Parent and Training and Education is where the advocates that are in the education group get parents in, and they're teaching them how to be their own advocate when they go into a school to write that IEP for that special kid. And I've learned so much in the year about how hard this is. I was lucky I was in a great school district, and I didn't have to know as much as some of these parents have to know. How hard it is, how you have to word things, how you have to fight for things. And so it's teaching them, because like I said, there's not enough of us to go out and do it for you. We have to teach you how to do it and how to say it. And it's amazing. I have an Asian family, and my 2 kids are Asian, as you saw. And so she heard about me, so she came to talk to me thinking I could speak. And I was done at Ni Hao. And so I said, but I have somebody here that's Hmong that can help. So we have been a team. I don't go with her, but you should see her. She was this quiet, shy mom who her son needs a ton of help at school, but she didn't know how to do it. You should see her now. She doesn't need us at all. She's amazing. She's learned how to do it politely. She's learned how to do it succinctly. She's writing her own IEP and turning it in. And when they don't like it, she doesn't sign it. She knows. So she's doing great things. It's all about just teaching them how to do these things. We had 11,421 calls just for educational last year. So it's crazy. And there's no systematic. Each county's different, I'll just say that, which is a scary thing. But transition, we have a beautiful transition program, and it's transition for employment and education. So it focuses on adolescence after high school, into college, employment, housing, community, and then we get into adult healthcare, which is my focus. But the other transition team helps with assistive technology like the Live Scribe pen to help kids in college. They do interviewing skills, social media they teach. They have workshops and live streaming sessions for these kids and families, teaching them, and then teaching them how their parents and them, if they can't advocate for themselves, how to do a 504 or an IEP to take to college, because yes, you can take them there. Next. The housing conference, it was canceled because of that wicked snow, but last year we had over 450 people that came, and we had, I don't know how many people that teach kids and are places where kids can go if depending on their capability to live alone. And so all of those people were there. There were handouts and business cards handed out to help families understand where their kids could go, if they can live independently or if they have to be in a group home. But there were things so you didn't have to be frustrated at home trying to sort through 10,000 things. Go ahead. The populations in transition, and it's been talked about here, but it always makes me crazy if I can't interject when I'm sitting in the audience. But it's different, and so it's chronological. There's kids with, their age is different than their developmental age. There's medically complex and fragile, and they have rare diseases that 90% don't make it to adulthood. So my daughter wasn't supposed to make it past 2. She's 21. And so when my guy calls me, and when the doctor that finally listened to me and went and did something, she was a doctor, and I thank her every single year. I call her, I send her a thank you note. They call me to say, we're glad that we were wrong. But it's different populations that need to transition. So there are kids that are capable and ready. My other daughter that's 23, she's driving. She's a certified barista at Starbucks, Minnetonka. Go there, say hi. I didn't think it would ever happen. She's rocking it. She's great. But she still lives with me, and she will for probably a long time, because there are other things she can't. Her bedroom, holy cow. But I mean, there are things she can't do by herself, right? So there are kids that need that practice, the guidance. So it's hard to lump transition into one thing, because it's totally different. It's unique for different groups. Even if you say they're autistic or they're on the spectrum, they could be all over the place. So it's different, and that's critical. Mental illness is another whole story. So this, has anybody ever seen this? You love it? So I teach a class in care coordination. I know it's too little and you probably can't read it, but the gist is that's us in the middle. That's the family, and this is all or some of the people that touch our life on a daily or weekly basis. So in the care coordination, we had families do this to say, look at all the people. And when I said, take that to your doctor when you go, so he understands, because it's not a criticism of the medical profession at all. They're so busy taking care of us and trying to get us well, they just don't know some of that. And so this one actually was on the web because the other ones were not as well suitable for a slide, but this was on the web under care coordination. But it just gives somebody an idea how much we have on our plate and how much work goes into it to show you how many people are involved in our life to keep our kiddo on the right track. Go ahead. Medical transition, okay. I have to say it's a parent's perspective, but I talk to, what did I say, there's 45,000 calls we get. I talk to tons of parents all over. And we know what we want. We know what we expect for our kids. We want patient-centered, coordinated, uninterrupted care. From where we are now, I have 23 specialists. And to go and trying to travel and do all that is crazy. But they all are amazing and they all get it. I moved here for that kind of existence. So there's challenges. There's, I don't know who said it, but there's a difference between transfer and transition. I even say there could be a warm transfer, which means like my guy, my primary care guy is amazing, but he's learning with me. And he said, I'm not going to let you go until I know that you guys have what you need to exist, and that you don't be, you're not scared. And so he said, I promise you. And one of the reasons that it's so hard is there's policy changes, pre-existing conditions, there's dependent coverage. Thank God now I can cover my kids till they're 26. There are childhood diseases that kids are lasting longer, like my Maddie, and the adult version of this disease is even rarer, and the symptoms are totally different. Totally different. Pediatric hospital, God love them, versus adult hospital is a scary thing and doesn't always feel safe. Not that it isn't, I'm just saying it from a parent's perspective. And so that's all scary. So since she's 21, as I'm working on this, and I was given names of pulmonologists. 4 I called. Nope, can't, sorry. GI. Oh, nope, sorry. I called every hospital in the vicinity that I would go to about her GJ tube. You know who carried it? Children's. Only one, and that's because I set it up so that they carry it and stock it. So if I come in an emergency, she doesn't eat by mouth, people. She only eats by her tube. So somebody's got to listen when I say we need that, so when we need to get that in. And she's a diabetic. So we have to make sure. And that hospital, nobody else even had it. When I talked to the radiologist, he said, guess what? I don't know if anybody else knows how to put those in. She's got spinal fusion, so when you look at it, I've done it once because they didn't believe me, and I showed them in radiology. But I have to go, you could laugh and you know that's true. And I had to go by all those rods. It's a hard thing to do. But we gotta talk about this because we're not done yet. We gotta figure it out. Next. Other challenges are we have, of course, and I think a couple of people mentioned that, we have long patient-centered relationships with our pediatric team. I would tell you that almost all 23 of my doctors know my daughter's favorite color. They all notice and ask her if she has a boyfriend yet. I don't have one yet, they never asked me. But I mean, they know her and they love her. And that's a scary thing to leave. We have found in some of the people that we've interviewed that some of the family practices aren't comfortable. In her case, and in a couple of families I'm working with that have autistic kids. Med Peds docs, you guys know what those are? Med Peds docs? They're going to be our answer, I think, because they have both. And so I think, but there's not enough yet. I think that's going to be a big help, but we still have to have the infrastructure to handle it. And right now, I feel like we have Dr. Patience White, who is now one of my good friends. She was instrumental in gottransition.org. If you've never seen that site, somebody else mentioned it. She and I actually had her as a guest speaker for my board so that she could talk about it. And then she laughs because she knows what I'm going to say. Oh, this is great. This is great stuff. We're teaching them everything. But patience. Guess what? I don't have any place to go. These forms are perfect. Everything's great. So we got all that. We got what we need to do. We're teaching that. But it's like packing a backpack and then sending them to a pack and then sending them to the end of the cliff and say, yeah, there's a parachute's going to come out. There isn't. Not yet, not enough. And so we're working it. We're trying to be a team, and there's so many good people doing so many good things. We just need to be a team together and try to figure it out so we can make it real. And Patience actually does that. Dr. White does that. She's worked at Mayo Clinic. She's worked at Cleveland Clinic trying to do the infrastructure that's needed next. So what I say to you is let's all, because everybody here is so smart and has such a passion for what you do or you wouldn't be here. So let's be a community of change. Let's figure this out. I'm working with Wendy back there at the Department of Health. We're going to figure this out. We're going to add as many people as we do to figure it out. Okay, I have to say this. Be a home care nurse. Come on, come on, come on, come on. Okay. This just kind of shows you. This is at the stadium. I don't even know what it's called. We're at the big U of M stadium. is a big part. TCF, yeah. And the girl down with the sunglasses is one of the best home care nurses I've ever in my life met. And she's from PHS. So Anna, is Anna in here? Where is she? Anna came. Oh, Anna from Midwestern came to my house. She's going to be a home care nurse. Don't tell her I said that. Okay, and where's Mervin's? The photographer. Where is he? He's been at my house. He's going to be a home care nurse. I don't know, but PHS, you better give him a card, Mark. Because we do fun things. Go ahead. Be on a team to help improve our healthcare delivery system and improve health outcomes. Be on a team. Don't be afraid to talk about. You guys, you young kids out there, you're the next generation. Get off your texting, get off your technology, and communicate. Help, make a difference, change something. You should see some of the things these residents are doing differently. It's amazing. Next. Be passionate every day. I'm not really that passionate. Be passionate every single day because you can make change. I've seen change. And you guys can be a part of that, all of you. Doesn't matter how old you are. You can make change and do change, right? I have to say this because that's where I work. So donate and volunteer at PACER so that we can continue to offer all the free services that we do to families. We'll be passionate, but just help us. If you want to volunteer and see what it's like there, come visit us. Go ahead. And practice patient-centered cares like our physicians do. Practice and try. I call it, when I do the presentation at the U, I call it, be a shoe shifter. Anybody know what that means? Put on the shoes of somebody else. So take yours off and try to see it from the patient's perspective. Patient-centered care is what they say. But think about it and do it and try to figure out how in the heck did that patient get here with all the stuff and what happened, how did she explain to work that she had to take off? Think about all those things from the patient's perspective. It'll make you the best in the world. Oh, wait a minute. Did I say be a home care nurse? Mark, did I do good? Yeah. Yeah, so this is another event. Nick is so phenomenal. Nick is a gentle giant. And I don't know if I should tell him about the man wall, probably not. But we had a doctor that, we were in the hospital for almost a year. We were getting pretty depressed, and he brought in a fireman's calendar from St. Paul. But they didn't have shirts on. It was delightful, I have to tell you. And so we actually have now 3 walls in my living room that are decorated because people see it, want to know why they're not on it. Mark's not on it yet. But we have everybody from the Schwann's man to the pest control guy to people that want to be on it. We also visit once a year the Firehouse 8, I think it is, 8 or 9, and we go down and they perform for Maddie. They tune the lights and do all these things because of the calendar. So be a home care nurse and you can go with us, okay? Thank you. Any questions? I don't know if I've gone over.